Again, you're always going to get all the resources from here. So if you miss something, no worries. The recording is always going to be available to you. All right, Laura, let's go to the next slide. Again, we have a really big group today. We've got people from all over the region. So if we call you out, give us a wave. We always like to see where you're from. If you decide to chat in or unmute and ask a question today, just really be conscious of your PHI, which is your protected health information. So don't share anything like your child's name or the school they go to or where you live or anything like that. You want to protect that as much as possible. And again, we have poll questions because we like to learn so that what you tell us helps us design the next series. So please fill those out. Your voice matters. And we really want to know if we're hitting the mark and addressing things that you want to learn. All right, next slide. Again, if you're new to Zoom, here's just a couple of quick features. If the red bar is over your mute or your video, that means we can't hear you, can't see you. If it is not there, that means we can hear you, can see you. So please keep that red bar over your mute, over your audio, so that we don't have a lot of that background noise, especially when our presenters are presenting. And again, if you want to go ahead and put in your name on your little square, you just hit the 3 little dots in your square and you can change your name, put your name in there, turn your camera on. Again, we really like to see everybody who's part of the series and be a community of learners. All right, next slide. I should have said also, feel free to chat in questions. We always like to have, we have a lot of people looking at the chat, so we're happy to help if you have any questions. Like I said, you're going to have access to all the resources and slides from today's session. So just stay tuned for more of that. We've been running about 48 hours or more to get all of that out to you in an email. So keep a lookout for that. If it doesn't come soon, it will be coming. We're always working on that. Next slide. And again, Project Echo is really about moving knowledge, not patience. And we do that through case-based discussions like we're going to do today, and also through didactic presentations where you get to learn about a specific topic. So we're always going to follow the model that Project Echo has put out. It's incredibly successful, and we all are very well versed in it, and we all really like it. We're always going to do welcomes and hellos and meet everybody, and then we'll get into a case presentation where we really talk through some case issues that might really be relevant to what you're dealing with, so that you can do some learning from that. We'll get into the presentation from our speakers today, and then we hope that what you'll do at the end of this is really take what you've learned, apply it back into your own home, to your own child, and then share that out with your providers, with your care team members, and with your community. Because the more that we learn and share, the better we, the more we can move learning in the field of autism. Next slide. All right, so today's agenda, we're going to, again, do the welcomes, do the poll questions. I want you to meet all of the hub team members that are here today. We want to meet some of you and see where you're from, and then we'll get into our case presentation, talk through the anxiety presentation, and then do questions and discussion. We always do record this, so be knowledgeable of that. And we do collect some of the data, like where you're located, things like that, and we use it for, making maps and, again, just like sharing the results of our series. So it's part of the ECHO process. Next slide. All right, and Amanda, do you want to kick us off with introductions?
Sure. Hi, everyone. My name is Amanda Bennett. I'm a developmental behavioral pediatrician at Children's Hospital of Philadelphia, and really happy to be here today. Lisa.
Hi, everyone. My name is Lisa Nowinski, and I'm a clinical neuropsychologist and the director of clinical services at the Mass General Hospital Lurie Center, just outside of Boston, Massachusetts. And I will pass it over to Eric.
Hi everyone, I'm Eric Butter. I'm Chief of Psychology here at Nationwide Children's, and really happy to be together with you all again today. I'll get to introduce Dr. Bennett and Dr. Nowinski a little bit more later. But for now, let me hand it off to one of my favorite people in the world, Sapna Shetty.
Hi there, I'm Sapna. I'm a marriage and family therapist here at Nationwide Children's Hospital. I love working here and I love being with all of you today. I will pass it on to Sabrina.
Hi everyone, I am Sabrina Long. I'm a social worker at the Child Development Center at Nationwide Children's Hospital. Super excited to be here. I'm going to pass it on to Amy Hess.
I'm Amy Hess. I am the family partner that's part of this team. It's great to see all of you. I wanted to mention Andrew Nelson is not here today, but JJ, do you want to unmute and introduce yourself in his place?
Sure. Hi, my name is JJ Hurley with Autism Speaks, and I am one of the Autism Response Team members and resource specialist for Autism Speaks, along with my colleague today, Tony Hernandez.
All right, and Josh Edwards is running a little bit late. He is not here yet, to my knowledge. So I'm going to pass it over to Cody Hostetler.
Everybody, I'm Cody Hosteller. I'm a psychologist that works in primary care here at Nationwide Children's Hospital. Who is next? I've lost track.
Amy would be next.
I'm next. Okay. So I'm Dr. Amy Newmeyer. I'm the Chief of Developmental Behavioral Pediatrics here at Nationwide Children's Hospital. Dr. Bartram is also one of our developmental behavioral pediatricians here, but she's not going to be able to make it today.
All right, I think that's everybody. Angie Fideli is also not able to be with us today. She's with the CARE Network. So next slide. JJ, you introduce yourself. So Tony, I'm going to turn it over to you and have you introduce yourself, and then we'll go to the rest of the team.
Yes, hi, good afternoon to everybody. My name is Tony Hernandez. I'm part of the Autism Response Team alongside JJ with Autism Speaks. We're here to help with any resource information as possible. I'm also bilingual, so if there are any Spanish questions that can come in, I'll be more than happy to help with that.
And hi, everyone. I'm Nancy. I'm here with Melissa and Maura. Teresa's not with us today. We are part of your tech support team. So if you have any challenges at all, reach out to any one of us that says support in front of our names or drop it in the chat and we'll try to help you out.
All right, so participants. So I want to welcome Hawaii, Wyoming, and the other new one is Alabama. We have people from those states, which we haven't had up until now. We are currently in 39 states. So we have participants from almost the entire United States. So look, if you know anybody in North Dakota, have them give us a call. But we're really excited to have so many of you here. Next slide. And we have participants from 9 countries today. So Ireland is new for this session, as well as I think the Philippines has been here a couple times. So welcome. We're really happy to see you and ask questions as you need to. Next slide. Again, you know, one of the purposes of Family Echo is to really take the medical and behavioral information that we know that we use with our patients here, you know, across our network, and we really want to make sure that we give it back to families like you, so that you can take this information and apply it back into your homes, into your families, and again, give it back to your communities. So that's really what we work towards, and that's why your input and you know, guidance on this series is really important to us. Next slide. And again, you know, I think the thing I always say is, you know, being the parent of a child with autism, I always say that, you know, my view I'm part of the care treatment team. I'm part of the, you know, the discussions that need to occur. And, you know, as a family member, our voices are really valuable because we know a lot of information that as we share them through clinic visits, it can really help to guide the next steps in clinic care and in treatment pathways. So we really want to encourage you to take what you learn and, you know, take it back to those care providers that you're working with in those treatment teams, you know, and learn as much as you can so you can share it, because, you know, what you learn and what you give back is really going to, you know, have impact on your child's life and your family life. Next slide. One thing I wanted to say is that, you know, up until now, we've completed 3 sessions in the series, and today we're going to talk about anxiety. So we've covered some behavioral topics. We've covered ADHD. Now we're going to do anxiety.
No, she wants to hold on to it, okay? No, she wants to hold on to it.
Marcy, do you want to go ahead and mute for it? Thank you. Our next session that we're going to do in December is really going to be about, we call it the session of all sessions. We're going to talk about strategies to build supportive care teams, and, you know, the importance of self-care for parents and families. I mean, I think we're seeing that a lot in some of the discussions we're having with you now. We're also going to look at, you know, how do you reach out to resources and what's really out there and available, not maybe just locally, but nationally, that might have impact on you. And then we're going to have a self-advocate here who's going to talk about leadership skills and resources, you know, and how to build autonomy in young adults. So we're excited to have Josh join us for that. Next slide. All right, Cody, I'm going to hand it to you for the poll questions.
All right, everybody, we have some questions for you today. In just a second, there we are. You should see some questions on your screen. It's okay if you don't know the answer, just take your best guess. The first one is a true/false question asking, it is generally easy to identify what a child with autism is anxious. I think it's supposed to say when. I think we already got some typos in the polls coming in the chat. So it is generally easy to identify when a child with autism is anxious. True or false? Children with the autism spectrum disorder are blank to experience anxiety during their lifetime as compared to their neurotypical peers. So that is more likely, less likely, just as likely, or not likely. And then the last one is also true or false. Children with all abilities and levels of ASD symptoms are at higher risk for anxiety. True or false? Wow, you guys are quick. We've already got 45, 46, 50% of people who are answering. Thanks everybody for putting in your answers. It's also good to see that we have some mix in our answers as well.
Remember, if you can't see that last poll question, just scroll down and you'll be able to, that'll pull up and you'll be able to see it. Cody, these are really great. We have a lot of people answering questions.
Are already up to about 75%, 71%. Hit that 75% mark. All right. Looks like the poll is ended. Thanks everybody for taking some time to answer those questions for us.
Hi everyone, this is Sapna back here again. So I'm going to share a case vignette for us to ponder on as a group. And as I share this case, I'd like for us to think of what else would we want to know before we advise this family member. So this child's name is Lucas. He's 11 years old. He was diagnosed with autism at 4 years of age. There's been an increase of behaviors. Lucas lives with his mom, his father, his older sister, and grandparents. The family identifies as Caucasian. He has been doing well at school until recently, and he's just recently transitioned into middle school. And we're looking at his history of supports. He's received speech therapy, occupational therapy, ABA therapy, and is not on any medications at this time. And then we can switch to the next slide. And then looking at presenting concerns, he wakes up agitated and has been presenting with non-compliant behaviors. He's been struggling with directions to get ready for school in the morning. Teachers report that he's easily distracted, rocking while sitting in class. He's also expressing abdominal discomfort and reduced appetite. There's been an increase of isolation and refusing to go for activities that he used to once love doing. The school is identifying these symptomologies and behaviors as being due to his diagnosis of autism, whereas the family is concerned that there may be something outside of his diagnosis of autism that's triggering some of these symptoms. And I'm going to pass it on to Sabrina, who's going to walk us through his clarifying questions.
Thank you so much, Sapna. So as we do with our ECHO case presentations, someone presents a case and then we are able to ask clarifying questions to gather more information about the case. So does anyone have a clarifying question for Sapna? Are the behaviors only happening in school? Great question, Summer.
So there are some behaviors happening at school, but it sounds like there's also been challenges at home, especially in the mornings, getting ready for school. And those were things that he did comfortably in the past, but he's been struggling with it recently. Great.
Are there, oh, there's so many questions all at once.
A lot of questions.
Changes in the home?
No changes in the home. Grandmother's been living there for quite some time now.
And Anne had asked, where is he with respect to puberty?
That's a great question. And I don't know if we hit upon that yet in sessions, but that's definitely something to think about.
Let's see. So Celine asked, what has changed in the student's environment?
There hasn't been, I would say the most significant change for Lucas has been that transition from elementary to middle school. And the family does report that they start to see some of these new struggles happening around that same time.
And then there are some questions about sleep. Is he sleeping well? What is his sleep pattern at night?
As far as the family is aware, he seems to be sleeping well once he falls asleep, but he has been having some struggles falling asleep.
And then as far as the stomach issues, any medical follow-up with stomach concerns, any concern for constipation?
That's a great question as well, and definitely an important question to ask medical providers. There was nothing that was reported by family, but it would be something important to check in with the family on.
Any supports at school, IEP?
He does have an IEP at school with his diagnosis of autism, and receives some additional supports around academics, extra time getting schoolwork done, things like that. And then speech and OT at school as well.
Are there any extracurricular activities?
No extracurricular activities at this time.
How about a behavior plan at school?
That's a good question too. I think that there is one, but I'm not sure how recently it's been updated, or if there was an update when he transitioned into middle school from elementary.
And Sapna, someone wanted to know about friendships.
That's a really good question too. I love these questions. I think he has a handful of friends that he likes to engage with, but I would say most of that interaction is through video games versus meeting face to face.
Cool. Let me see what else is in here. Is he getting enough sleep? Has he been? Lots of sleep questions. Any bullying happening at school?
No bullying that the family's aware of, and I don't think anything was reported by the school either.
Lily asked a question. Did the change happen when he entered? Is there something specific he can point to when his stomach hurts?
I don't know if he, so the family is sort of making that connection, that wondering if this transition to middle school is what's increased some of these, the stressors and then some of the struggles in the morning. But I don't know if he's directly said anything of, in connection to middle school. And around, the question around stomach, the stomach pain, I don't know if he points specifically to a certain area, but he just more complains about his tummy hurting.
Okay. Oh my goodness, there's so many good questions in here. Someone asked about unusual weather patterns, diet, food changes.
Those are all really great. I'm not sure about the weather piece, but I can see what you're thinking about here, and just in terms of season change, it's the seasonal changing, and so that could be something to look into. I'm curious with just connecting with Dr. Neumeyer, thoughts that she might have of things for us to consider as well.
I think this is like a tremendous set of questions people have already asked. So I had some original thoughts on the case, and people have been going right down that list. But
yeah.
I think, as a physician trying to think about, what could all the different causes be for the symptoms that we're seeing. And so thinking about potential medical causes, which people have done in terms of like what things could be causing stomach aches. I'm thinking about things like sleep and how that can affect behavior. And also thinking about, those changes with middle school and what things could be related there. I think one thing I thought of too, Sapna, I don't know if we have any thoughts on, is just for this particular patient, his communication level and his ability to kind of tell us how he's feeling and what's been going on for him at school.
Mm-hmm. Yeah, I think someone shared that question as well in the comments of if he's what he's expressed as being a challenge. And from what I've engaged with family around, it doesn't sound like he's able to make that connection yet. He describes just not wanting to go to school, or that it's not feeling well. I don't know if he's able to identify what exactly it is about school that's been hard for him, if that's what's causing some of these symptomologies.
Sapna, Gregory asked, what does Lucas have about what is going on?
And yeah, that's a great question. And so I don't think he has a lot of insight specifically of what's bothering him, but I think he sort of that struggle of getting him ready for school. I'm wondering if that's sort of his way of having his parents sort of understand that there's something about school that's been hard for him.
Great. Cody, do you have any other questions as our resident psychologist today.
Yeah, I love the questions, and I love the themes of the questions, like really trying to get at, when do these symptoms occur? Is it just something that he's always experiencing? Is it a time of year, a time of day, a day of the week? Because that could really tell us a lot about whether, if it's only happening during school days, feeling anxious, about school, or only happening on the weekends, or when structure changes. I love those themes of the questions, and also alternative explanations for what might be going on, like all these sleep questions, knowing what's going on with sleep, particularly if he's feeling kind of down and not interested in doing things. So from a psychologist perspective, I love that we're thinking about these questions, because these are important questions to ask providers as well. Could it be this? Could it be that? And understanding what kind of questions are providers going to want to hear, like those details about situational specificity, like what situations it occurs in.
Who has a recommendation for Sapna and her patient? Where do we go next with this family?
Sabrina, this is Amy. I think one of the things that I would recommend from a parent perspective is that I found that collecting data, so that when I bring in like as much information as I can to, like, my behavioral health or my behavior treatment team, or with my med providers, it's really helpful, because then I can accurately reflect back over the last, several weeks, maybe several months of things that I'm seeing, so that I can help to, really come to a conclusion of what should we do next, whether it's a medication or a behavioral treatment. But I found that even if I write it on a scrap of paper, or if I put it on a, some kind of a computer, Excel sheet, whatever it might be, I've just felt, I feel like data is really important to collect and share, because it really helps to paint the true picture, not just the picture of the day that I walk into the clinic.
Amy, that's great. That's exactly what I'm seeing in the chat too. ABC logs, team meetings, check in new like IEP meetings, parent training.
I love these recommendations, because it really sort of strikes me that it's, the importance of coordinating care and collaborating with other members or providers that are connected with your child and experiences your child on a day-to-day basis. I think that's crucial and really important.
I'm just, one of the comments that came up, I think is good, is even thinking about making videos. If there's certain behaviors or things that you want to show the provider, those can be helpful for us, for sure. And I think the other thing that I find helpful is any communication that we can also get from the school. So that could be, something more detailed, like a daily kind of back and forth behavior log, but even like a note from the teacher on what they're observing. Those things are always really helpful to us as well.
Yeah, I mean, I love that. I think, Amy, if a family was to come and see you, you would probably make these recommendations. Check out the GI constipation issues, any sleep issues, talk about possible medications.
Okay. Yes, absolutely. It looks like I might be having some mic problems, so I apologize.
Oh, no, you're okay.
My new computer.
Someone asked, has he been identified as high risk for anxiety in past evaluations? I think that's a great question.
That is a great question. I do not think that was identified as being, acknowledged or recognized historically. And from engaging with parents, it doesn't sound like there were very visible symptoms of anxiety earlier on, or as intense as they're noticing now. So I think just right now, with it impacting day-to-day functioning, is why they're reaching back out to providers.
Thank you. Someone else mentioned art therapy, occupational therapy, to see if maybe different sensory inputs would help. These are all great suggestions. Thank you all so much for all of your suggestions and thoughts on this case. We are ready to move forward, Laura.
Well, hello, everyone. It's my pleasure to introduce our speakers today. You know them as part of our hub. Our first speaker is Dr. Lisa Nowinski. She's the clinical director at the Lurie Center for Autism and an instructor of psychiatry at Harvard Medical School. She's a clinical neuropsychologist, has more than a decade of experience diagnosing and caring for individuals with autism spectrum disorder, as well as other neurodevelopmental disorders. Lisa specializes in diagnosis and neuropsychological assessment of individuals with autism, really across the whole lifespan. Her work focuses on collaborative models of assessment that involve parents and caregivers as active partners throughout the assessment process. You heard earlier the need for parents to bring a significant amount of information, including videos, to the process. Dr. Nowinski is one of these people who really values that. She's a member of our care network, and she's on our behavioral science committee. She's an invaluable resource there, and she's worked with professionals really across North America on several specific initiatives, including several local and national ECHO autism initiatives. Joining our neuropsychologist in today's presentation is a developmental behavioral pediatrician, Dr. Amanda Bennett, and she is at the Children's Hospital of Philadelphia. Dr. Bennett is not only a physician, she's also a public health expert. She has served as the site director for CHOP's Autism Treatment Network site, which again is what we now call the Autism Care Network. She's clinical chair of CHOP's Autism Integrated Care Shared Governance Committee and the medical director of CHOP's Center for Autism Research. Provides clinical care to children as well as young adults and consults in several diagnostic clinics with community partners, both in the Philadelphia region and on a Native American reservation in Arizona. I've had the pleasure of working with both of these professionals for a number of years. I learn from them every time they talk. You're in for a treat. Let me turn it over to Dr. Bennett and Dr. Nowinski.
Thanks so much, Eric. So I'm going to kick things off. We're going to talk about a lot of these questions that people have been raising. Is it anxiety or is it autism? So understanding and managing anxiety symptoms in the population that has autism spectrum disorder. So first of all, what do we mean when we talk about anxiety, right? So anxiety is defined as having feelings of fear, worry, dread, unease. You know, we see these things as being negative, but some fear can be healthy and protective. So there's a degree of being fearful, as we learned from Inside Out. There's a degree of being fearful that is healthy for children, but when it gets to be too extreme, next slide, that's when we see concerns for what we would call anxiety disorders. So these are anxiety symptoms that are persistent or getting worse and really interfering with a child's ability to function in day-to-day life. And anxiety disorders can present with other symptoms. So it may not necessarily always just be fear or worry. People could have physical symptoms, racing heartbeat, they might be sweating, there could be trembling or shaking, and they may present with some physical health complaints like sleep or GI problems. Next slide. So when we think about how anxiety can affect a person, one of the things that I always think about is, are the symptoms that the child is experiencing more externalizing or internalizing? And that can be really helpful in terms of trying to identify if a child is having anxiety, right? So a child who is anxious that has externalizing symptoms, they're a little bit easier to pick up on. They're the ones that are having tantrums. They may be arguing or refusing. They may be engaging in more repetitive behaviors, repetitive questioning, or repetitive comments around certain topics. They may be eloping in certain situations that they find stressful. Whereas a child who is internalizing, they're sometimes a little bit harder to recognize. They just may be more withdrawn. They may be worrying, but not necessarily sharing that worry. They may appear more sad, more distracted, or they may have changes in their appetite or sleep pattern. Next slide. So then when we think about how anxiety and autism are related, it gets even more complicated, right? So autistic people have higher rates of anxiety across all ages. Depending on what study you look at, it can be anywhere from 20% to 80%. Looking at studies that focus on children, it seems to fall right around 40% of kids with autism who are presenting with anxiety symptoms as well. It can be more difficult to recognize anxiety, particularly if an individual is minimally verbal or not able to articulate what they are feeling. And there can be some overlap between anxiety and autism. Next slide. So this is a nice summary that looks at how anxiety and autism can look a lot alike sometimes, right? So an anxious person may have social avoidance. A person with autism might have some social communication difficulties that make them appear more avoidant. A person who's anxious might have difficulty with conversations if they're feeling really nervous in a social situation. They might have difficulty adapting to change. And we know that people with autism can struggle with transitions and have a preference for routines as well. People who are anxious might have obsessive thoughts, or they might have compulsive behaviors. People with autism tend to have some perseverative interests and repetitive behaviors that can sometimes be difficult to know if this is obsession and compulsion or perseveration and repetition. People who are anxious might be hypersensitive to their environment and have more negative thoughts in general. And people with autism can be more sensory focused sometimes, which might also present as hypersensitivity, and they can have more symptoms of irritability. So there's a lot of overlap between these two diagnoses. Next slide. And there has been a little bit of work in trying to understand how people with autism who also have anxiety might present a little bit differently than just a traditional anxiety presentation. So people with autism can have traditional anxiety symptoms and meet the traditional criteria for an anxiety disorder, but they might also have some unusual or atypical anxiety features. So they may have more worry around routines or new situations, or their very restricted interests. So some of those perseverative interests might actually also create some level of anxiety for them. They might have some really unusual fears, like babies crying or the happy birthday song. There may be a worry about a social situation without necessarily understanding all of the nuances of that situation, or maybe not even necessarily having the concern about social rejection. They're just anxious about the social situation in and of itself. And they may have those compulsive or ritualized behaviors without meeting full criteria for OCD. So OCD would be when you have obsessive thoughts that are tied to worry about a negative outcome, and you have compulsive behaviors that you tend to engage in to avoid that negative outcome. And people with autism may have those same obsessive and compulsive thoughts and behaviors without necessarily having that clear desire to prevent that negative outcome. Next slide. So I'm going to pass this over to Lisa.
Thanks so much, Amanda. Now that we know what anxiety is and a little bit more about how it can appear in autism, I want us to think together about how we can figure out if your child might have some anxiety. Next slide. So anxiety is typically diagnosed by a mental health professional, somebody like a psychologist, psychiatrist, or therapist. So other doctors like developmental behavioral pediatricians may help facilitate an initial diagnosis. As always, if your doctor is unsure or unable to evaluate your child for symptoms of anxiety, ask for a referral to a specialist. Next slide. The first step in a formal evaluation will likely include a visit with your doctor to talk about your child's symptoms of anxiety, some of those behaviors that Amanda just shared with us, and also the coping skills and strategies that your child may be trying to use when they're feeling anxious. As always, the more specific that you can be, the better your doctor will be able to help make an accurate diagnosis. And so you want to think about ways that your child might be avoiding specific situations or activities, if they're showing increased stress or behavioral response in certain situations, and whether or not those changes have, those behaviors or symptoms have changed in any way due to recent environmental changes. Next slide. Your doctor may also ask your child's teacher or you to complete some rating scales. In some cases, if your child's able to complete rating scales directly, your child may also be involved in this process. It's important to hear your child's perspective on their own symptoms and experiences. Next slide. Finally, your doctor is going to help you determine whether or not your child's specific symptoms meet criteria for any specific anxiety disorder based on the DSM-5 or Diagnostic and Statistical Manual, which is a book that helps us to define diagnosed mental health conditions. As you can see here, there are a range of specific anxiety disorder diagnoses that range from things like separation anxiety to specific phobias to more generalized anxiety. And we want to achieve a specific diagnosis to help us understand how we can support and treat those symptoms for your child. Next slide. Once you have a specific diagnosis, and probably even before you have a formal diagnosis, you're going to be thinking about what you can do to help. Let's go ahead and move on to the next slide. Fortunately, there are lots of things we can do. Today, we're going to be talking about 4 main treatment options, including environmental and behavioral supports, parent training, cognitive behavioral therapy, and finally medications. So let's go ahead and review some of the environmental and behavioral supports. These are things that you can do at home, no appointment needed, to set your child up for less stress or lower anxiety. I want you to think about things like maintaining a regular schedule and routine for your child, previewing transitions and changes in routine, using social stories and other tools to prepare your child for new or unfamiliar experiences, balancing high stress and low stress activities, and trying not to schedule too many stressful activities, things that you know will put particular pressure on your child all in one day. Allowing extra time to complete particularly stressful activities and try to avoid rushing. Also providing really frequent praise for your child's attempts at trying hard and new things. Modeling that approach to hard things in life is really important. So your child can see you try hard things and make it through. We also want to make sure that you're making time for your child to decompress and de-stress, particularly during and after high stress situations. And prioritizing your child's sensory motor needs will help with regulation and potentially reduce anxiety and stress. Next slide. Next, I'd be remiss if I didn't talk a little bit about parent training one more time. I know we've talked about this in all of our previous sessions so far, but as parents, you hold such powerful influence in your child's life to help them face anxiety-provoking situations in adaptive ways. There are lots of things that we can do to either improve or worsen symptoms of anxiety for our child. In fact, anxiety in many ways is a vicious cycle, right? Imagine that your child's nervous. Your first instinct may be to help or rescue them and sort of take them out of whatever situation may be causing them to feel stressed or anxious. However, every time we avoid or run away from those things that are causing us anxiety, that response can teach our body that we must have escaped certain death and that we should feel even more anxious and worried the next time we experience that situation. So we want to be really mindful of the ways that we respond in situations where our child feels anxious. Let's take a look on the next slide here at parent training in action. So this is one example. I'll have you go to the next slide, Wura. This is one example of a situation where your child may experience some anxiety. Lots of children, particularly those children with autism, have significant anxiety around doctor's visits and medical procedures. And I want you to think about these 2 scenarios. In both situations, your doctor has prescribed a new medication and they've scheduled your child for a blood pressure check in the office. In the first option, you take your child in for a quick check after school on the way home. And immediately when your child gets into the office and they see that blood pressure cuff, they start screaming and kicking and pushing to get out of the office as fast as possible. They're very anxious and stressed by that experience. As a consequence, your child didn't have their blood pressure checked. They left the office and you all ended up stopping to get dinner on the way home because you were incredibly stressed. Now imagine option 2, same situation, same new medication, same need for a blood pressure check. In option 2, you're working with your therapist or your treatment team to support your child's anxiety and behavioral needs. You're doing things like previewing the appointment with your child and creating a plan and schedule for this. You're using a social story to review the steps that will be involved in getting your blood pressure checked at the office. And you're allowing your child to explore or practice this skill, potentially by visiting the office or exploring with their teachers, even a play blood pressure cuff at home, practicing on you, having them practice on their dolls. In this situation, you schedule an appointment. Your child's prepared for this. They know it's coming. You get to the office and your child's able to sit through the blood pressure. They're not calm, they're anxious, they may be scripting and breathing rapidly, but they make it through using the tools and strategies that you've learned in parent training. As a consequence or result, your child completes that blood pressure check, and now you can celebrate on the way home. And I just want to pause because it's clear in this example that one option would reduce anxiety and promote future success with doctor's visits and blood pressure checks. Obviously, real life isn't this simple, but I share this example because I want you to understand the general power of parent training and the power that you hold when you're engaged in treatment in this way. Next slide. Next, we're going to talk a little bit about cognitive behavior therapy, or CBT. So what is CBT? Well, CBT is a very well-researched therapeutic modality that's effective in reducing the symptoms of anxiety and building positive and effective coping skills. Next slide. CBT is based on the idea that how you think determines how you feel and how you act. There are a few key elements to consider when we're using CBT for anxiety and autism. First, it's really important to help a child with autism build their capacity for accurate emotion identification. This can be uniquely challenging because of some of the core symptoms of autism that your child may be experiencing. We also have to address or challenge irrational beliefs and automatic thoughts, and we'll talk more about this in just a minute. We want to incorporate safe and supported opportunities for exposure and practice, and we want to help a child build more effective coping skills and problem-solving strategies. Next slide. So first, let's run through just a really quick example of what this might look like for you or I. Let's consider this situation where we have to give a big presentation at work. In the first situation, you may have the automatic thought that I'm a terrible speaker, I always sound stupid, and I'll probably lose my job when I mess this up. You're feeling 8 out of 10 anxious, really anxious. And on the day of the presentation, you call in sick, you bail, and you get in trouble with your boss, right? We can see that this was not a productive outcome. In the second line, you'll see you still have to give that presentation, but if you're working to challenge your automatic thoughts, you might be able to shift that thought to something a little bit more positive or neutral. I know the material and I'll be able to refer to my notes if my mind goes blank. In this situation, you still feel anxious, but now you're feeling a 4 out of 10 anxious. You're able to make it to work. You complete the presentation, you get great questions from your team, and your boss offers some praise. You can see that just some of those small shifts can make big and significant changes overall. Let's think through on the next slide an example that may be relevant for our kids. Oh, we'll go back one slide, Laura, sorry. Thank you. In this example, we're talking about a kid who's lost their backpack on the ride home from school on the bus. In the first line, you'll see the automatic thought is my mom's going to get mad at me. She'll probably punish me. She'll take away my Xbox. In this case, the child may be feeling anxious. They may even be feeling angry or frustrated. And they end up avoiding their mom. Then they lie and tell them that they don't know. So she doesn't know. They don't know what happened to the backpack. And they blame it on another kid who was on the bus with them. In the second situation, as a child works with changing their automatic thoughts, you can see that they might be able to shift their thoughts to ideas like my mom cares about me and she wants me to do well in school. She knows the bus driver's phone number. Maybe she can help me call. Still feeling worried, but a little bit more optimistic. In this case, the child's able to tell mom what happened. Mom's able to text the driver. They find the bag and pick it up, right? So you can see where some changing some steps along the way can have a significant change on the outcome. Next slide. Now I want us to talk through a little bit about CBT. We've talked about CBT in general, and I want us to think through a few things that are important to consider when we're using CBT with people with autism. There are lots of ways we can support and modify traditional CBT models, and we're going to walk through those. Next slide. In the first, preparation is key. You want to make sure your doctor knows your child's profile, that you share evaluation reports and behavior support plans, and give permission for your team to communicate. You also want to think about session structure and format. What would be best for your child? Would it be better to do it individually or in a group? Do they need a shorter session length, in person versus virtual? Do they need to stretch treatment out over a longer period of time with shorter sessions? Next slide. We want to also think about how your child's core features of autism will impact their treatment. For example, do they need more support in building social skills and competencies early on? Do we need to specifically work on building self-awareness and emotion identification? And how can we promote social engagement. For many anxious children with autism, anxiety and social challenges can be a vicious cycle. We can't help one area without supporting the others. Next slide. We're also going to think about supporting individuals' cognitive and language needs. So this could include modifying therapy tools and content to be developmentally appropriate, placing more emphasis on the behavioral techniques and working in coordination with other behavioral therapy modalities like ABA, incorporating visuals and allowing plenty of time for practice and processing. Next slide. In the next slide, you'll see lots of things we can do to support engagement and motivation to participate in treatment, things like involving your child in goal setting. I know there was a question in the chat about how much we talk about these things with our child or in front of our child. It is really important to involve your child in the process. Incorporating, and this is really one of my biggest tips and takeaways, is finding ways to incorporate your child's special interests or affinities in therapy. These can be powerfully motivating interests that keep your child engaged and invested in the process. Using technology has been found to be a helpful way to get children with autism engaged in the therapeutic process, and also incorporating reinforcement strategies and sensory motor breaks. Next slide. As always, parent involvement is really key. We talk about this all the time, and you are all here and part of this talk, and so that's wonderful. You're already a step ahead, but we want to make sure that you're involved in each session. So this isn't sort of a drop your child off and pick them up an hour later. It's important that you're involved because we want to make sure that your child can teach you some of the skills that they're learning in therapy so that you can take advantage of those skills and help support your child in using those skills throughout the rest of their week. Think about ways you can use parent-only sessions and ask your child's therapist for specific strategies that you can apply at home. Last but not least, make sure that you're seeking some individual support for yourself. Anxiety only causes more anxiety. So if you're feeling stressed and anxious, which many of us are, it's really important to do some work on our own, to use CBT that will work for all of us too. Next slide. Finally, we'll talk just briefly about generalization. We know that generalization is hard for many children with autism, and so we want to plan for this from the beginning. This can include incorporating real life or in vivo practice, sometimes called exposures, and leveraging our home and community-based providers to help partner with us through the process of therapy. Next slide. All right, so let's think a little bit about CBT in action. In this case, we're going to talk about a young man named Matt. So Matt is a 13-year-old male with ASD, ADHD, and generalized anxiety disorder. He has average cognitive skills, but his language and communication challenges are notable. He also has significant executive functioning challenges and slow processing speed, and his frustration tolerance is fairly low. Matt's anxiety centers largely around social and peer interactions, but he also has significant fear of getting in trouble and a real fear of the unknown and new things. Matt's historically has shown challenging behaviors. So Dr. Bennett talked earlier with us today about those internalizing versus externalizing symptoms, and Matt's symptoms have tended to be more externalizing, right? Showing some aggression and property destruction. And those previously have been conceptualized as problem behaviors, challenging behaviors, and really treated by his school team and in-home ABA services. Matt was never referred for cognitive behavior therapy for anxiety, in part because his anxiety wasn't fully recognized. After Matt was referred for CBT, he was able to join us for about 12 or 13 sessions. And one of the biggest things that we did to change Matt's CBT was to use his interest in Star Wars. This included using visual supports that had characters and pictures and graphics from Star Wars. And we used those characters to practice new skills. So instead of asking Matt to apply the skills immediately to his life, we'd first start by asking him to apply those skills to characters in the Star Wars series. We also used more simplified language and worksheets, and we ended up doing sessions at sort of a shorter session length due to his frustration tolerance and processing speed over a longer period of time. It was very helpful to coordinate his CBT with his ABA team so that they were able to change or shift their conceptualization of some of his externalizing behaviors and really understand the underlying anxiety that was contributing to those challenges. And his parents definitely joined us at the end of all of his sessions. Again, he really found it exciting to share with them what he was learning and what our Jedis were learning so that they could carry some of those skills over at home. Next slide. Just a couple of references here. There are two really commonly used cognitive behavioral protocols, including Facing Your Fears and the Coping Cat program. These may come up if you're interested in learning more. I've got the information here. And on the next slide, you'll see just a couple other books and resources that may help you be helpful for you as you're learning about supporting your child with anxiety. Amanda, I'll pass it back to you to now walk us through that last step of treatments that's so important, the medication component.
Yes, so we spend a lot of time talking about therapy when children are anxious. Sometimes, most of the time, our goal is that that is effective enough. However, in some cases, even with really excellent therapy approaches and even with parents kind of using all of these behavioral strategies, sometimes it's still not enough. And the times that I talk to families about, I usually will bring up medicine early only to say, this is something that we have available to us, but we're going to try and use behavioral strategies first because they have such strong evidence that they work so well to address anxiety symptoms. And I think of it as learning skills that this individual can use for the rest of their life to manage their anxiety, as opposed to trying to cover things up with the medication. That being said, there are times when symptoms of anxiety are in the moderate to severe range and they're impacting function that medicine might need to be considered. So when we talked about ADHD in the last session, we talked about how if symptoms are impacting learning or social participation or family quality of life, sometimes we need to think about medication. And in this particular case, and I saw someone bring up something in the chat as well, sometimes a person's anxiety may be so severe that it's really holding them back from being able to participate successfully in their cognitive behavioral therapy approaches. And in some cases, a very low dose of medication to manage those anxiety symptoms makes it easier for them to learn the skills through CBT. Next slide. So there are not a ton of FDA-approved medications for anxiety in children. There are many that are used, and they're used off-label, and they're typically used quite successfully. But when we look at actually, approved studied medications, we don't have a ton to choose from. Medicines are always going to be best used in combination with behavior interventions. And people brought this up a lot when we were talking about the case. It's always really important to make sure that we're addressing other symptoms that might need to be managed that might mimic or worsen anxiety, things like sleep, irritability, GI symptoms. Next slide. So if we think specifically about medicines used for anxiety, next slide. The ones that are used the most often and have some evidence are selective serotonin reuptake inhibitors. So there are many different types of SSRIs. These are antidepressants that are often used to treat anxiety symptoms in adults, and some are used in children. There's buspirone, which is an anxiety-specific, it's an anti-anxiety medication. Sometimes antihistamines can be used, and then in certain circumstances, benzodiazepines can be used. So we'll talk about these briefly. Next slide. So thinking about the SSRIs and pros and cons of considering a medication like this, these are probably the most commonly used medications to treat anxiety in children. They are effective in reducing anxiety symptoms. They have not been shown to necessarily reduce some of the restricted or repetitive behaviors that might seem like anxiety in people with autism. There have been studies looking at SSRIs to try and reduce those perseverative behaviors and interests, and it doesn't seem to necessarily be helpful in that area. There have been some studies that have shown improvements in irritability and agitation when a child is treated with an SSRI, and these improvements tend to be seen more often in adolescents and adults. The data on younger children is a little more difficult. There are side effects with all medicines. So thinking about the side effects for SSRIs, one of the things that I always tell families to look out for is a child that becomes behaviorally activated. So we are trying to reduce anxiety, and if in the process what we get is a child that is now overly confident or overly active or overly happy and silly, sometimes we can overshoot where we're trying to go. Sometimes children can become more irritable with these medications, and there can be changes in sleep and appetite with these medicines, and they're not necessarily clearly an increase or a decrease. So we just have to sort of see how the child responds to these medications. It does seem that children with autism have more sensitivity to the side effects of SSRIs than the general pediatric population. So that's always something to be aware of when we're trying a new medicine. Next slide. So buspirone is an anti-anxiety medication that is pretty specifically targeting anxiety. It doesn't get used as an antidepressant. It has been shown to reduce anxiety symptoms. There's been some reduction in those restricted and repetitive behaviors seen in children that have taken this medicine, and you can also see reduction in irritability symptoms. The side effects that are most often reported with Buspar are appetite changes and sedation. Clinically, what I find with this medication is it either helps or it does nothing. It can be an option, particularly if a child has not responded well to an SSRI. Next slide. So hydroxyzine is an antihistamine. It's an anti-allergy medication, but has been shown to reduce symptoms of anxiety. It also can be a little sedating, so sometimes it's used for insomnia. So it can be a really nice option if you have a child who is anxious and it's impacting their ability to sleep at night. It can be used as needed, so you're not committing to taking the medication every single day, which is also a potential benefit. As with every medicine, it does have some side effects. The sedation can be helpful at nighttime for a child that's having trouble sleeping, but can also be problematic during the daytime. And as an antihistamine, it can cause dryness in the mouth and the eyes, sometimes a little bit of nausea. And the effects with hydroxyzine tend to be more short-term. So, maybe 3 to 4 hours of benefit. So again, for a child that's really anxious and worried to bedtime, it might be helpful. But because of the sedating effects, it's sometimes not as useful during the daytime if a child's anxious all the time. Next slide. And then benzodiazepines. So these can be very helpful for symptom control. These are medicines that are used to manage seizures. They can be helpful with anxiety. They can help people who have sleep problems, and they can help with agitation. They can also be used as needed, and they can be really helpful for short-term situations like getting on an airplane or going to see the dentist or having blood drawn. But there's a high risk of paradoxical reactions, which means that you have the opposite effect of what you're hoping the medicine will do. So a benzodiazepine should be calming, relaxing, and if a child has an opposite effect, they are more agitated, more activated. There are also side effects with these medications, sedation, dizziness. They can cause dependence. So these are not medicines that we want someone to be taking every day. And partly because of dependence, partly because they do have some anti-cognitive effects. So they can actually reduce a child's ability to make progress in other developmental skills if they're taking these on a very regular basis. And if they are taken in high doses or an overdose, they can result in death. So I reserve these for really very highly necessary short-term situations to get a child through a small procedure or to get through a flight if they don't handle airplanes well. With all of the medications that I talk about ever, I'm going to be telling families that we're going to start with low doses and we're going to take it slow, because whether it's an SSRI or an ADHD medicine or anything that I'm treating with the medication, knowing that my patients have a higher risk of side effects in many cases, I want us to be very cautious and take our time so that we're not creating more problems. Next slide. So to summarize all of the things that Dr. Nowinski and I have talked about, anxiety is more common in people with autism, and those symptoms of autism and anxiety can overlap a lot, which can make it really tricky to figure out which symptom is being caused by autism or anxiety, or in some cases both. And we know that it's common, so in a lot of cases it might be both. behavioral therapy is definitely the most effective approach to addressing these symptoms. And medications have side effects, but may be necessary to maximize those behavioral therapy effects if the symptoms are severe enough. And I think there's one last slide that shares some resources. So I will often share this medication decision aid. This is a toolkit that Autism Speaks has on their website that families can use. It sort of walks you through the types of questions you might want to ask your child's doctor, the medications you're considering, what you're hoping they're going to do. It's a really nice kind of workbook to help you think through and help you make a decision if you think it's time to consider a medication. And then they have this really nice one-page resource on anxiety strategies. The link was really long, but if you Google Autism Speaks anxiety strategies, this is one of the first things that pops up. So I like to share this with families as well. And I think that's the last slide, but we will open this up for questions.
Yeah, thanks all. So this is the same questions you saw the last time. We're just curious to see if your answers have changed after hearing the presentation and seeing all the wonderful discussion that's been in the chat.
All right, so while you're doing the chat, I'm going to go ahead just to keep us on time here and go through a few more slides. Continue to fill out that poll for another minute here. JJ, do you want to talk about some of the supports you can offer? Because I know you've offered that to a lot of families that have been on the call today. JJ, I think you're muted.
I'm so sorry.
Okay.
Hi, everyone. As you've seen throughout, and I just again placed the information in our chat box, the Autism Response Team is available Monday through Friday, 9 to 5 local time. We're available via email, chat on the website, or phone. We have 2 different phone lines. We have toll-free English line, and then we have our bilingual line as well. You can see that information there. We are happy to help answer questions you may have, connect you with local resources, provide our toolkits that maybe I know people were talking about sleep, and we have, as mentioned on the presentation, Autism Speaks has a lot of resources for anxiety as well. So I would encourage you all, if you have questions, I know this is a quick webinar, but please reach out to us. We'd be happy to try and help you. My colleague Tony and I and our 7 other members are ready to help.
Great, thank you, JJ.
Thank you.
All right, we'll do like another couple seconds on the poll, and then Melissa, you can pull it down. Thank you for filling that out. It's great. Again, it's great it helps us learn. It helps us to understand what your needs are when we do these sessions. Again, if you need to have, we again give feedback when we send out the link to do the survey, the satisfaction survey. Please fill that out. It offers you input into what you'd like to see happen in this series. And I know that some of you also did that during your registration process. So continue to do that. We're sorting through all that so that we can design the 2022 series. Next slide. And again, if you need a certificate, let us, or they'll automatically will come out to you, and it takes about a week or so to get those out, especially when we have bigger groups like this. So you will get one. But if you don't see one or have issues with it, always feel free to email us, and we'll help you with that. Next slide. And again, the sessions for the materials for today are all going to be available to you. We'll get those out to you. The link is really nice because if you go into the YouTube link, when you do get the session recording, you can actually flip it and put it into another language. So if you'd like to read it in another language, that's an option on YouTube. So it's a great way to share it as well. And next slide, I think it's the last one. And again, our next session is going to be on December the 8th. Materials for that and registration for that will be coming out probably in the next week. And it's the session of all sessions. We're going to have tons of conversation, resources, and we might even touch back on some of the themes that we've talked about so far with ADHD, anxiety, and behaviors. So Melissa, if you want to go ahead and pull the